Let's discuss with NBC News White House correspondent Monica Alba, MSNBC senior enterprise reporter Brandy Zadrozny, and Dr. Amish Adalja from the Johns Hopkins Center for Health Security. Monica, we've just learned that Secretary Kennedy sent a letter to CDC staff last night. What did it say?
Yeah, late last night, Anna, he sent this to all the employees at the CDC at around 9:30 p.m. And of course, many of them likely participated in that walkout yesterday that you saw for those top officials who resigned in protest after all of this back and forth, and really showing how complicated and what a crisis this has been for the agency. Now, what the HHS Secretary, Robert F. Kennedy Jr., wrote in his letter was specifically trying to tell them that he still believes that the CDC leads one of the most vital missions in the nation's government. And he is arguing that President Trump is completely aligned with his common sense vision for the CDC. He goes on to write that he's committed to working with the staff to restore trust, transparency, and credibility to the CDC. And he says the American people are ready to believe in this agency again if we show them that integrity, accountability, and science guide every decision. Now, it's interesting that he did use the word science there, Anna, because that is the crux of at least the back and forth we understand between Menarez and between Kennedy, and that there was this eruption and debate over vaccine policy, and she effectively said that she wouldn't back down and didn't want to rubber stamp anything that didn't take science into account. Anna.
Dr. Adalja, what's your reaction to this letter and the secretary's claim that science will guide the decisions when these ousted leaders say that is the opposite of what was happening?
RFK Jr. doesn't know what science is. His definition of science is an invalid definition. And when he says that he wants this common sense, it's actually a nonsense vision he has for infectious disease control in CDC. He has been a disaster at the head of HHS. He is pursuing an irrational, nihilistic program to disintegrate the value of vaccines. And this is something that we should have expected to happen. And I'm glad that the people at the CDC have the integrity to stand up to him, because more people need to, or this will continue.
Brandy, Menarez is now fired. You have these 4 other top CDC officials resigning, a mass staff walkout. What are you hearing from people on the inside?
Despair. These are a lot of really, really upset people who have weathered 7 months of Secretary Kennedy's power hold on HHS and public health. You know, they have weathered this storm because of those bosses, those health leaders that just stepped down. And so they told me that those leaders were like a bulwark for the worst of what Kennedy meant to do. And they were operating very strategically for a long time until they decided this recent thing with the vaccines. They wanted Menarez to basically rubber stamp some new vaccine recommendations, and she said, no, that's not based on science. I need to talk with my team. And Kennedy said, well, then fire your team. And she said, I can't possibly do that. So when you said that Nixon Saturday Night Massacre, it really was like that. But there is despair. They are worried about the health of every American, and especially children. They truly, truly do think that this will cause the death of children and other Americans.
Doctor, I want to play what 2 of those now former CDC officials said regarding the serious red flags over RFK's leadership. Watch.
I learned about the change to the COVID vaccine schedule on Twitter. I then asked, as well as others, if we were able to see the data that supported the decision, and I was told no. And so, you know, that's highly concerning.
What we would actually have preferred was to have more interactions with the secretary. My senior leaders never were able to brief the secretary, our scientists, on any of these issues. We were hopeful that we would find some sort of common path, but again, we never had the opportunity to brief the secretary on any of this science or data.
Doctor, if the scientists and the doctors at CDC don't trust their boss, then can everyday Americans?
No, I don't think that you can trust the CDC at this point. It can only be viewed as a propaganda arm for RFK Jr.'s nonsense. This is not the storied public health agency that responded to crises from HIV to Ebola to COVID. This is now part of RFK Jr.'s apparatus to dismantle the vaccine ecosystem and to push his ideas, which have no basis in fact or reality. So, no, I don't think the CDC is a place that people can trust, and that's very sad. That's hallowed ground to me. Anytime I've walked into the CDC, I'm in awe looking at the portraits of the directors that have been there. it's really a tragedy, and it's going to make not only the United States less safe, but the entire world less safe. And now we're going to have to turn to alternative sources like professional societies to help us understand what's going on in the world of infectious disease, because the CDC has been ruined by RFK.
So those other professional organizations may be a great resource for you as a doctor, for our viewers, but hard to believe it's come to that. Monica, Democratic senators are now calling for RFK Jr.'s firing. A few Republicans are also raising alarms, including Senator Bill Cassidy, Senator Susan Collins. What is the White House's stance? How are they defending the health secretary right now?
Well, they are saying that Menarez was, in effect, not aligned with the president's own vision when it comes to public health. But of course, he did select her. He nominated her. She only got through that Senate confirmation process and was installed about a month ago. But they are now taking a very different tune on this. Here's what White House Press Secretary Caroline Leavitt had to say in her explanation yesterday.
Her lawyer's statement made it abundantly clear themselves that she was not aligned with the president's mission to make America healthy again. And the secretary asked her to resign. She said she would, and then she said she wouldn't. So the president fired her, which he has every right to do. It was President Trump who was overwhelmingly reelected on November 5th. This woman has never received a vote in her life.
Now, as for who is going to be the acting CDC director, Anna, this is somebody who has been a close ally of Secretary Kennedy. He has been a trusted aide of his. His name is Jim O'Neill. He did serve in the Bush administration. He was somebody who was very critical of the CDC during the COVID pandemic. And this is somebody who has been aligned with Kennedy again on that vaccine policy, which is a really clear emerging issue here and something that they believe he will be able to execute the White House and Kennedy's vision on in this role. And he was Senate confirmed, we should point out, in the deputy director capacity. So that is why he's able to do this now.
Brandy, the future is still wide open here, but just in the past few months, Secretary Kennedy has canceled billions in research, done mass layoffs. He's purged vaccine panels, replacing them with loyalists. He's given prominent vaccine critics key roles, relitigated long-debunked claims on vaccines and autism, undermined his scientists during the Texas measles outbreak, made policy changes via tweet. He's accused doctors of corruption because they questioned his new guidance. I mean, that's not even all of it. It's gotten to the point where you have prominent medical professionals, you have former CDC officials basically saying, ignore CDC guidance at this point. Is there any precedent for this?
No, I mean, he broke the CDC. I don't think it's hyperbolic to say that. They will say that themselves. And I think what's even more alarming about this is even if we have hearings, even if this stops right now, we're never going to know the true extent of this, or we're not going to know the true extent of the damage that he's done for decades to come, the toll on public health he's already taken. It's so unprecedented. It's so dangerous.
Doctor, anecdotally, we've already heard about some confusion among public-facing medical workers at hospitals, at pharmacies, unsure about the certain vaccine protocols now, for example, with COVID, and who can get what. What are the dangers here if it becomes a free-for-all, if this central body doesn't drive public health?
Well, right now, a lot of my colleagues are trying to develop an alternative system. There is the Vaccine Integrity Project, the American Academy of Pediatrics, the Infectious Disease Society of America are all trying to develop their own schedules that are going to be science-based, and that's going to help. But in the interim, there is a lot of confusion. And what's going to, the worst case scenario is people that are high risk aren't going to know whether or not they need the vaccine, whatever vaccine it is, flu or COVID or RSV or whatever it might be. And what ends up happening is you have preventable deaths, hospitalizations, and severe disease occurring because of this chaos. And this is exactly something that you would predict would happen when someone that's been an anti-vaccine advocate for decades gets put in charge of vaccines. And that's what's happened. And what we will see is there are going to be deaths that likely could be prevented if people knew the right information about vaccines. But he thinks that the COVID mRNA vaccines are the most dangerous vaccines ever developed, for example. So this is the exact opposite of what you want to be happening going into the respiratory virus season.
Dr. Amish Adalja, Monica Alba, and Brandy Zadrozny, thank you all very much.